One of the most common problems that we see in treating foot and ankle problems is heel pain. Heel pain can come on suddenly and just develop on a moment's notice, or it can really develop as an insidious problem over a period of days or weeks or months. But when a patient comes into the office and complains of heel pain, usually it's significant enough that it really is limiting their daily activities. When a person complains of heel pain, it can be located in several areas. More uncommonly, it occurs at the insertion of the heel cord or Achilles tendon into the heel bone. The most common complaint is heel pain that occurs on the inner border of the heel bone in this region. Although really heel pain occurs because of inflammation in a larger area, for some reason this is the most common location. The second most common location is on the undersurface of the heel, right below the heel bone. Now let's look at a model of the bone itself, because I think that that helps us to understand the architecture of the foot in a better fashion. We start off looking at the ankle joint in this region, and now that you're oriented there, let's look more at the undersurface, because this is the heel bone or the calcaneus, and this curvature in this region right here is where a structure called the plantar fascia inserts. Now let's go ahead and look specifically at the plantar fascia in a model that I've created. The plantar fascia is a structure that's located on the bottom of the foot. It runs from the heel region out to the metatarsals and toes, and it is a triangular shaped structure that actually is fairly dynamic. What happens when one steps down on the ground is that this arch of the foot, which is a curved surface, tends to straighten out somewhat, putting stress on the plantar fascia. And one can certainly develop pain in this region, but most likely the common area of inflammation is in the insertion of the plantar fascia in the region of the heel. This is a nice schematic diagram demonstrating the attachment of the plantar fascia to the heel bone and how it courses all the way across the bottom of the foot out to the toes. As we stand on the toes, we stretch the plantar fascia. When you walk in the morning and you put a stretch on this plantar fascia, that's why you develop heel pain. But a more common cause is inflammation in the region of the plantar fascial insertion. The most common location of heel pain is on the medial or inner border of the foot at the tip of the heel. Frequently, your treating physician will obtain an x-ray of your foot to examine the bony structure. When we look at the heel bone, we're looking for any sign of a stress fracture or even a heel spur, which might occur in this region. This person obviously does not have a heel spur. On this x-ray, we see actually two spurs. We see one in this region and one in this region. And this person actually had pain on the undersurface of their heel where this spur occurred. And here in this x-ray, we see a relatively large spur. Note, though, that the weight-bearing surface of the heel is right here. A person doesn't really bear weight on the heel spur. In this diagram, we can see the weight is borne not on the heel spur itself, but on the undersurface of the heel bone. One cause of heel pain is thinning of the fat pad on the bottom of the foot, but a more common cause is inflammation in the region of the plantar fascial insertion. Entrapment of one of the nerves in the region of the heel may be a cause of chronic heel pain as well. Two major sensory nerves on the undersurface of the foot can lead to a condition called tarsal tunnel syndrome. Another cause of nerve entrapment is in the region of the heel spur, where a small sensory nerve can become inflamed and entrapped. Another cause of heel pain that has to be considered is inflammatory arthritis. Occasionally, patients will present with other aches and pains in other joints, and we have to consider rheumatoid arthritis, ankylosing spondylitis, gout, and other types of situations that can cause inflammation in and around the body. So from time to time, we may order lab tests such as a blood count, a sedimentation rate, and other studies looking for inflammatory arthritis. One of the most common causes of heel pain is a patient being overweight. It's interesting when we look at the literature that heel pain is typically an American disease. We're big people, we tend to weigh a lot, and because of that, when you look at our arch and when we step down, that curved arch tends to stretch out, and as it does, it puts stress on the plantar fascia, which causes heel pain to occur. We don't see heel pain in the slightly built Oriental population and in general in smaller people. So I guess really America has really a corner on the market on heel pain. So when we get into our treatment plan, what we're after is the cooperation of the patient in trying to get their weight down a bit, because that obviously is one of the causes of the problem. Now, it doesn't mean that just because one goes out and loses 20 pounds that heel pain will disappear. Usually heel pain takes many months to come on, and so it may take several months for the heel pain to disappear, even though one loses weight and does many of the other conservative methods that we'll suggest in this discussion. Probably 80 to 90% of heel pain can successfully be treated with conservative methods. Really, when one thinks about it, I feel that surgery is very uncommon for the patient with heel pain. But it does require a concerted effort to do many of the things that we will suggest. It's interesting, over the last probably 20 years in my experience, we've tried lots of different things, and what I've tended to do is discard the things that didn't work at all and to include in this program the things that I think have a good chance of reducing heel pain. Obviously, one of the things that helps is an anti-inflammatory medication. This can be an over-the-counter preparation or can be an anti-inflammatory medication that's prescribed by your physician. Concomitantly with this is getting out and exercising to help you lose weight. When you go out, you should try to walk, or at least get up to walking a mile or two a day. That may be difficult to begin with, but with the use of an anti-inflammatory medication, pain usually is not quite as bad, but the first few days may be painful as well. Another device that we commonly use is a heel pad. These Viscoelastic heel pads are very soft, and when people are out walking and trying to exercise, cushioning the heel with a device such as this often can reduce their pain as they help to stretch their plantar fascia and exercise more. A foam heel cup is sometimes used for heel pain and is placed in the shoe to cushion the heel in the region of the Achilles tendon. The more common complaints of heel pain seem to be associated with getting up from a chair after sitting for an hour or so, or getting up in the morning and stretching the foot and feeling an immediate onset of pain. That's because when you sleep, one doesn't sleep with their foot in an upward position. The foot is down in this position like this. And then when you step out of bed, you stretch the heel and stretch the plantar fascia, and it hurts. Likewise, when you're sitting in a chair, your foot is often flat on the floor in this position. It's not held up in the air. Therefore, with the first few steps, one stretches the plantar fascia as well, and pain comes on. One of the most effective treatments for heel pain is a nighttime splint. We found that by keeping the foot and ankle in a little bit greater than a 90-degree position, we keep the heel cord and the plantar fascia stretched out. In a review in which we talked to a number of our patients and we asked them what they thought was the most effective type of treatment, they felt that the nighttime heel splint was probably the most effective means to decrease heel pain. In the treatment of heel pain, the use of an arch support or longitudinal metatarsal arch pad can be very helpful in reducing pain. Both a left and a right pad is included in the heel pain kit, and you need to choose the appropriate side. There are a few tricks for placing this pad into the shoe, and I'd like to share those with you now. When we examine the shoe in relationship to the anatomy of the foot, we realize that the arch is on the inner aspect. So in the placement of the pad, part of it goes on the upper area or inner aspect of the arch, and part goes on the insole. If one just peels off the pad and sticks it down in the arch area, if it's not in the right position, it's very difficult to move, especially after a patient's been walking on it for a while. A better technique that I've found is to peel back the adhesive paper just slightly, so that there's just a little bit of the pad showing. Another trick that I'll do is I'll trim around the arch pad so that there's not as much paper inside the shoe. It's more comfortable then to see if it's in the correct position. Then in the placement of the pad, we move it up on the inner aspect of the shoe, as we see here. Once the pad is in the shoe, you can carefully slide your foot into the shoe and step down on the pad in a weight-bearing position and see how it feels. You'll usually know right away whether it's in the right position or not. Sometimes it'll feel like the pad is too close to the toe box, and sometimes it'll feel like it's too close to the heel. A nice trick then is then to just make a mark in your shoe where you've left the pad. Then what one can do is, because it's only attached barely to the insole with just a small area, you can either move it backwards towards the heel or forwards towards the toe. And say this one needs to be moved a little farther forward, you can stick it down, then again put your foot in the shoe and see how it fits. If it's a good fit, then I'll just make another mark like this and possibly another mark like this. Then remove the rest of the paper wrapper and put it back in the exact position that I want the pad to be in for the final fit. One then steps down again, and it should be a good fit. In the conservative treatment of heel pain, stretching exercises are extremely helpful in reducing symptoms of pain. Squatting at a counter and attempting to kneel down, stretching out the heel cord and plantar fascia can be very effective. Another easy means of stretching this tissue is to lean forward, thus stretching your heel cord and your plantar fascia. Although not a first choice, sometimes an injection of steroid into the region of the plantar fascial insertion will reduce pain. It's been shown in the literature that 65% of heel pain can be effectively treated with a short leg or below knee walking cast. Therefore, using the cast, while not a first-line treatment, may be used if some of the other treatments such as night splints and heel pads are unsuccessful. It's important to read through this pamphlet to pay attention to the various causes and treatment of chronic heel pain syndrome. Indeed, probably 80 to 90% of heel pain can be effectively treated with conservative or non-surgical methods. The things that we've discussed, such as cushioned heel pads, non-steroidal anti-inflammatory medications, stretching exercises, coupled with a night splint, are often the keys to getting rid and really curing chronic heel pain. It takes patience to get over heel pain. This problem may have resulted over a period of 3 or 6 or 9 months, and it may take a similar period of time of using these conservative methods to eradicate the pain that you feel with every step. Staying active means staying healthy. Sometimes heel pain can slow one down and really inhibit some of the activities that promote a healthy lifestyle. By trying some of the methods that we've discussed here today, I think the road to a happy and healthy life is right ahead.